Welcome, Dr. Zach from Cherry Health Center with us today. We appreciate you coming in.
Well, thanks for having me, Kelly.
Well, how long have you, talk a little bit about yourself, how long you've been with Cherry Health Center and where you're from and that sort of thing.
Yeah, so I'm from Ash Grove, Missouri, which is not very far away.
You're kind of a local.
Right, yeah, not too far from home. I've been at Cherry Health since August. I graduated from Southwest Baptist University with my doctorate. For undergraduate, I went to College of the Ozarks, so I've kind of been all over the place as far as schools here. I went to a lot of other schools to take some prerequisites as well. So, yeah, I've been in the area for a while.
Well, you're a physical therapist.
Yes, ma'am.
Okay, so let's talk about some of the ways that you offer people some options at Cherry Health. What are some things you do over there?
Sure. We treat primarily we treat a lot of chronic pain patients. So a lot of people have back pain and neck pain or knee pain, things like that. For many years, they come in, they've been all over the place, and they come to us because we have a little bit different of an approach. Instead of having to go to one clinic and another clinic, we have a doctor in the clinic that will see them. We have chiropractors in the clinic that see them, and then we have us that see them. So instead of having to go all over the place, you kind of come to us and get taken care of in one spot.
Okay, you've got lots of different options for helping someone out.
Right.
Let me ask you, let's just give an example. Say someone's in a car wreck.
Sure.
You know, that affects your neck and different things like that.
Yeah.
If something like that were to happen, do you suggest that people come in right away and start some sort of a treatment? Yeah,
it's best to come in as soon as you can after some kind of injury so we can kind of get a workup, do x-rays and that kind of thing, and start on the best course for
and that might avoid maybe arthritis and different things down the line?
Arthritis, the main thing we try to avoid with all of our interventions is surgery. So everything we do is geared toward keeping you away from getting surgery. So
what if somebody says, what if someone is told that you're going to need surgery? I mean, would it still be worth a try for them to come in and see what, maybe get a second opinion?
Yeah, we see that pretty often. Now, don't get me wrong, there's times when you need surgery, obviously, but sometimes they've been told that surgery is their best option. They come in, they see us for a while, and then they get better and don't have to have surgery.
And they feel better.
Right.
Okay, so let's talk about some of the ways that you help people. Decompression?
Sure. So we have decompression tables, which is basically a table that we hook you into a harness, and it applies negative pressure to your spine. The reason we do that is the majority of the time what's wrong with your back is that your vertebrae, the discs in between, have degenerated. So we apply negative pressure, and that allows fluids and stuff to come back in to heal.
Talk about what is negative pressure?
So negative pressure would be like if you had a balloon and you're pulling the two sides of the balloon. When you pull the two sides, pressure pulls in towards it. So if your disc is bulging or degenerated a little bit,
you want to get the pressure off of that.
Right, right.
Okay, how many treatments would somebody need?
So we usually do 24 treatments of that. You usually come every day, and then you'll also, most of the time, you'll do physical therapy as well as chiropractic along with it.
Okay, so you do support all the areas of help.
Yep.
What are some other ways that people could get help with physical therapy there?
So as far as physical therapy, what we do a lot of mobility stuff, a lot of stretching, a lot of strengthening because it's exercise. Physical therapy is primarily an exercise intervention. So we teach you specific exercises, not necessarily, deadlifts and squats. We're doing small exercises to get you moving, to get you back.
To make a big difference, because sometimes isn't it muscle weakness that causes problems with pain and that sort of thing?
Yeah, well, it's one or the other, chicken or the egg. You know,
yeah,
sometimes
which comes first?
the muscle weakness is because of the pain, but either way, we try to take care of the pain as well as strengthen you so that you're able to move again.
Right. So when you set somebody up, it's pretty much a 24-week therapy and.
If they're doing the decompression table, yeah. It's not weeks, 24 weeks, 24 sessions.
Oh, 24 sessions,
yes,
right, that's right. Okay, what's another...
So we have a lot of different machines that we can use as an adjunct to the exercise. We have a pressure wave machine, which applies a force in a little cylinder. Basically, it is using forces to break up any kind of adhesions or anything like that. So if you have any shoulder pain or other areas, we can use that to kind of take care of some of that.
It's just specialized in certain spots?
It depends, yeah. Shoulder pain, we've had some success with plantar fasciitis, that kind of thing, so foot pain, that kind of stuff, yeah.
What happens to our feet as we get older? Why do we have so much trouble?
Everything breaks down, doesn't it? Yes.
Yes.
Yeah, well, you're on your feet a lot, right?
Yeah, that's true. So they take a beating.
They take the brunt of all the forces that you're having to deal with every day. Yeah.
So you have like 3 or 4 different things as far as physical therapy that you could do to help people with.
Oh yeah, many things. Yep.
And then you were saying some doctors, like maybe steroid injections?
Yeah, we have a medical doctor. He does examinations, x-rays, and then if it's indicated, we'll do some injections. Yeah, we have doctors of chiropractic.
Right.
So you go to them and they adjust you, and then you come see us and we make you work.
Perfect. How can people get in touch with you?
So you can get in touch with us by calling 417-869-2000. We're at 607 Battlefield, right over in between Hy-Vee and National. Yeah.
Okay. Thank you, Dr. Zach.
Thank
It
you.
looks like you love your work, helping
do.
people to feel better, right?
It's great. Yep.
Yes. All right. Thank you so much.